I'm joined now by Dr. Kate Tulenko. She's the founder and CEO of Corvus Health. Why don't we start there with Hong Kong being stuck in the middle? Kind of describe for us what's going on there and kind of the difficulties we're seeing with the latest outbreaks. They're just cropping up all over the place.
So with the fifth wave of COVID that Hong Kong is experiencing, they've had a dramatic spike in the number of COVID cases. Really up until January, Hong Kong was able to maintain a zero COVID policy. But with the Omicron virus coming in being much more infectious, you saw a great rise in cases, especially amongst elderly people living in congregate settings who hadn't got vaccinated.
Shanghai, just a huge mega city, and you're seeing all the people east of the river, they're going to have to deal with the lockdown, then a little shift to west of the river. Talk to us about these efforts.
Well, you know, Shanghai is the business capital of China, and that's why I think we're seeing a little bit of a different approach to how they're doing lockdowns in Shanghai. There's a concern that if they do a complete lockdown, that it'll affect the economy. We're already having problems globally with the Ukraine war and supply chain problems in general. That's why you're seeing the approach in Shanghai of closing down one half of the city at a time and trying to be a little bit more flexible. And you now hear very prominent Chinese epidemiologists speaking out and saying we need to balance people's livelihoods with maybe a more dynamic zero policy.
You know, China's done such an amazing job in strangling these outbreaks. We've seen that over and over and over again. But it just seems like this variant is just taking off. What's at play here? Why is it so different this time around?
It's how infectious it is, and also that there are very high numbers of unsymptomatic people, so they don't know that they're infected and they spread it unwillingly to other people. So that's part of the problem. And another challenge I think that both mainland China and Hong Kong are having is it's a different set of interventions to achieve zero tolerance versus responding to outbreaks. And so China's had to be more nimble, introducing the rapid testing of COVID, also introducing other techniques such as the business office lockdowns as well.
You know, Wang Xiwen's story, back in the good old days, doctors made house calls. Now it's more like phone calls, these online gatherings, meetings with doctors. Can you talk to us about, some of the things you see with lockdowns, anxiety, mental well-being? What are some of the concerns there? And can doctors fill the gap there, do you think?
Well, we're seeing everywhere, all over the world, huge increases in mental health problems, from depression to anxiety, also, frankly, post-traumatic stress disorder as well. And it is certainly easier to access physicians and other mental health providers via telemedicine than face-to-face, especially during the lockdowns. The challenge is there already pre-COVID was a shortage of mental health professionals in most countries. Also, in most countries, there's a stigma about having mental health. You feel very comfortable telling someone that maybe you have an infection or that you broke your arm, but to say that you have depression, people look at you differently, and we have to break through these barriers and make people more willing to discuss their mental health.
Well, discussing it's the first step. So, Kate, thank you so much for your insights. Really appreciate it.
Thank you.